Welcome back. Today for our Midday Makeover, I'm joined with Laura Wagner from the Steuben County Health Department. Thanks again for coming in.
Sure.
And today we're going to be talking about the HPV vaccine and its effectiveness in preventing cancer. So to start out, for people that don't know, what is the HPV and the vaccine that goes along with it?
So HPV stands for human papillomavirus, which is why we call it HPV, because that's a wordy word. And really what it is a sexually transmitted disease. Unfortunately, it can cause cancer. So the most common type of cancer that it causes in women is cervical cancer. And in men, the most common type is throat or oropharyngeal cancer. Okay. But it can cause a variety of cancers. So the good thing about the HPV vaccine is you can get it when you're young, and that prevents you from getting cancer later in life. And who wouldn't want something that they could just get a shot, it's actually 3 shots, and prevent cancer.
And I was going to ask, at what age are these kids, boys and girls, both recommended to get these vaccines?
Recommended 11 or 12 is the earliest. Actually, you can start as early as 9, but really recommended 11 or 12, which is perfect because they're usually going in for their Tdap or their meningococcal vaccine for school requirements. So might as well just get the HPV vaccine while you're there.
And we were talking about this earlier. It's actually called the Gardasil shot. And we've kind of been seeing in the news sometimes that they're finding that it may not be as effective as they first thought, 10 years ago. Can you touch on that?
So there are over 100 strains of HPV. So even if you do get the Gardasil in the past or now, there are still the chance that you could contract HPV. However, the shot itself protects against the most risky types, so the types that are going to cause the cancer and genital warts. So it's really important to get the HPV vaccine so that you can prevent those types.
And we had talked about it also before, if somebody had got it 10 years ago, is it recommended that they, with this new vaccine that's out, to get it again if they still fall under that age of 26?
It's not currently recommended by the CDC to get revaccinated. If they didn't complete the 3 series, the 3 shots, they can complete the 3 later.
Okay, if they're under the age of 26.
Right.
Great.
Right.
Right. And then another thing we had touched on, you said sometimes parents may associate this with being, giving their kids permission to go out and be sexually active, but that's not true.
It's not. All the studies have shown that there is no higher link with sexual activity once people get the shot. Children don't associate shots with sexual activity or with anything, really. They know that it's preventing disease. Perhaps they don't even know what kind of disease it's preventing, but this one prevents cancer. It's not a permission for sex.
And anybody can get this right at their primary care doctor?
Absolutely.
All right, great. Well, thank you, Laura, so much